It's never easy to hear the words "you have cancer," but next weekend there's a Central Illinois-based program hosting a program to ease the pain and support people's mental health during the diagnosis. So I want to introduce Eric Nelson and Susan Leggett from the Cancer Center at Illinois. Thank you for joining us this afternoon.
Thank you for having us.
Well, let's just briefly chat about the event coming up on October 18th. Give me a brief overview of what it's all about for people.
Sure. So a number of years ago, the University of Illinois formed a group called the Cancer Research Advocacy Group, formed of patients, clinicians, and researchers, putting everyone in the same room so that researchers like myself could hear directly from patients what their unmet needs are. And in some of these discussions, we realized that outside of research, survivors need information on a whole host of topics. So we started a series. We launched a couple years ago with an in-person event where we had just an open discussion of techniques for survivors and managing survivorship. And then last February, we hosted a webinar for people who were just diagnosed, sort of how they can navigate the healthcare system and the health insurance system. And more recently, we have recognized that we need to start talking about mental health and the specific needs of cancer patients and cancer survivors with regards to cancer health.
So what are some of those resources that people can be connected to when they need help during this diagnosis and the whole process?
Yeah, absolutely. So of course, aside from things like going to therapy, part of our goal is to be able to provide resources that can go straight to patients just by having them learn about tools. So we'll have a clinical oncology counselor as a guest speaker for the first half of the seminar, so about 30 minutes, where he will talk about tools that he often presents to his patients. So that should be a direct way to learn about the different types of opportunities that are out there. And so that's one of our main goals, is to expose patients to things that they may have not heard in the clinic during a quick doctor's visit, and hopefully some of those tools will be, they can dabble and try those different tools to see if they're useful for them.
Let's expand a little bit more on that and really the importance of diving into some of these tools and resources for patients, their families, and other loved ones.
Yeah, when you're diagnosed, it's like getting hit by a ton of bricks. There's so many feelings, thoughts, emotions that you have to deal with. And most of us are just not equipped to deal with that alone. So like Susan said, we'll have a guest expert talk about the best techniques from the counselor's perspective. And then we'll finish the session with the roundtable with actual survivors talking about how they coped and how they managed and sort of tricks of the trade that they've used to manage their diagnosis.
Awesome. Well, that information is up on our screens. October 18th is the seminar, and we will have all of this information and more over on our website, WCIA.com, so people can get connected and get to know everyone with the advocacy group. Thank you for joining us.